do you know about low levels of HER2 expression in advanced breast cancer? HER2 is a protein that may be overexpressed on the surface of cancer cells. It plays a role in cell growth and tumor formation. HER2 testing plays a vital role in determining which patients with breast cancer are eligible for targeted therapies. Testing usually begins with IHC, and pathologists look for signs of protein overexpression based on the amount and intensity of staining seen on the slides. IHC scores are traditionally reported as 0, 1+, 2+, or 3+. Breast cancer has historically been classified as HER2 positive or HER2 negative, which helps to guide systemic treatment decisions. HER2 positive indicates that cancer cells are overexpressing the HER2 protein, and therapies that target those HER2 proteins could be highly effective. HER2 negative means that cancer cells are not overexpressing HER2 protein. However, we now know that even low levels of HER2 expression may be targetable by certain therapies like T-DXd. While HER2, 1+, and 2+-ish negative are considered HER2 negative, this low level of HER2 protein expression can be targeted in patients with advanced breast cancer. In 2022, the FDA approved T-DXd for the treatment of adult patients with unresectable or metastatic HER2-low breast cancer. HER2-low was defined as IHC 1+ or IHC 2+/ISH negative in the DESTINY-Breast04 study. In addition to HER2-low, there is now a concept called HER2-Ultralow. HER2-Ultralow is a concept that emerged in 2025 with the FDA approval of T-DXd in patients with advanced breast cancer who have an IHC score of 0, where faint, incomplete membrane staining was present in 10% or fewer cells. These patients responded to T-DXd treatment. So now, in patients with advanced breast cancer, IHC testing and scoring has become more nuanced, and pathologists need to spend ample time evaluating specimens to look for low levels of HER2 expression. When the IHC score is 0, it now matters whether there is no staining versus faint staining. The presence of faint staining means that the tumor has ultra-low levels of HER2 expression, and patients with advanced breast cancer may be eligible for treatment with T-DXd. When the IHC score is 1+ or 2+, and ISH testing is negative, these tumors have low levels of HER2 expression, and patients with advanced breast cancer may be eligible for treatment with T-DXd. HER2-Ultralow means the tumor is IHC 0, but with faint, incomplete membrane staining in 10% or fewer cells. HER2 testing and interpretation in advanced breast cancer is no longer binary. Positive versus negative. Low and ultra-low levels of HER2 expression by IHC could mean that certain patients with advanced breast cancer are eligible for targeted treatment. That's why precise HER2 testing in breast cancer is more important than ever. Learn more about HER2-low and HER2-Ultralow breast cancer by visiting the ASCP website, where you will find continuing education activities on this topic. This resource is supported by independent educational grants from AstraZeneca Pharmaceuticals and Daiichi Sankyo, Inc.